Hello, gentlemen. If you are in your 50s, 60s, or beyond, and you have noticed a change during intimacy, this is for you. You still feel the wave of pleasure and reach climax, yet there is no release as you expected. Maybe it happened once and your heart sank immediately. Or maybe it keeps happening and you have carried the worry quietly, mixed with confusion, fear, or even embarrassment about what it could mean. My name is Dr. Ada James. I'm a urologist with over 12 years of experience caring for men's health through every stage of life. Today, I want us to talk honestly and calmly. This conversation is serious, but it is also supportive. You are not alone in this, and you are not wrong for being concerned. Let me be clear from the start. What you are experiencing does not mean your manhood has faded or that your intimate life has reached its end. This is not a personal failure. It is your body communicating with you, a signal asking for attention, understanding, and the right response. Stay with me. In the next few minutes, we will break down what could be causing this change, the signs you should never ignore, and most importantly, the practical solutions modern medicine provides to help you regain clarity, confidence, and peace of mind. Before we get into why the fluid may be missing, let us first walk through how things usually work. Without the medical textbook language, picture your reproductive system like a well-rehearsed band where every part knows its cue. The testicles create the sperm. The seminal vesicles add most of the nourishing fluid. The prostate contributes its protective portion. Everything comes together in the urethra, ready for release. At the moment of climax, a series of muscles fire in a tight, rhythmic pattern. That coordinated squeeze pushes the fluid forward and out. It all happens fast, driven by precise timing between your nerves, glands, and muscles working as one. Here is an important point many men never hear. Climax and ejaculation are two different processes. Climax is the intense wave of pleasure controlled by your brain and nervous system. Ejaculation is the physical release of fluid. For most of your life, they show up together, so it feels like one event, but they are powered by different systems. Today, we are focusing on what doctors call dry ejaculation. This happens when a man reaches climax, feels the pleasure, but notices little or no fluid afterward. Many men describe it as an empty orgasm. That gap between what you expect and what happens can be unsettling, and that reaction makes sense. You have always linked pleasure with a visible result. But it is important to understand this clearly. Your ability to feel pleasure can still be fully intact, guided by your brain and nerves. The change is happening in the delivery system, not your desire or strength. This does not mean your vitality is gone. It simply means there is a specific, explainable reason within the body that needs attention. Before we move into the main reasons, let us take a brief pause. If this conversation is helping you, tap the like button so YouTube knows this message matters. Subscribe to be part of this growing circle. And leave a comment telling me where you are watching from. Seeing men support each other from different parts of the world truly means a lot. Now, let us get into the 3 most common reasons behind dry ejaculation. Understanding the cause brings back a sense of control. The first cause is what I call a relaxed gatekeeper, medically known as retrograde ejaculation. Here is what happens. There is a small but powerful muscle at the opening of your bladder that acts like a gate. During climax, that gate should shut firmly, forcing the seminal fluid to move forward and out. When this gate does not close properly, the fluid follows the easier route and flows backward into the bladder instead. You still feel the full intensity of climax, but there is little or no fluid released. There is a simple clue many men notice. After intimacy, the urine may look cloudy, because the fluid has mixed with it. This is usually harmless, but important to recognize. Why does this happen? It often follows prostate or bladder surgery. The surgery may be successful and necessary, but it can affect the nerves that control this gate. Certain medications can also trigger it, especially drugs for high blood pressure or prostate enlargement. They relax blood vessels, and in the process, they relax this small muscle too. I once worked with a very confident man who felt crushed after prostate surgery. When he learned this was a mechanical change, like a traffic light stuck on green, and that his desire and ability to feel pleasure were fully intact, the relief on his face said everything. The second reason is a blockage in the system, what we call a duct obstruction. Here is the simple picture. The glands are still doing their job and producing fluid normally. The problem is not production. It is delivery. Think of the ducts as narrow pipes. When those pipes are blocked, the fluid has nowhere to go. As a result, the amount released drops sharply or disappears altogether. What causes these blockages? Most often, it is scar tissue left behind after past infections, especially severe or untreated prostate infections. In rarer cases, tiny calcified deposits can form and clog the passage. The signs are often quiet. Some men notice a mild new pressure or discomfort deep in the pelvis during climax. Others notice the fluid becoming thicker and slowly decreasing over time. The reassuring part is this: many of these blockages can be treated. Reducing inflammation with medication is often enough. When needed, simple, minimally invasive procedures can reopen the flow and bring things back to normal. The third area to look at is hormones, especially low testosterone. Testosterone is the engine that powers the male reproductive system. It does more than drive desire and sperm production. It supports the prostate and seminal vesicles, the glands responsible for most of the fluid. When testosterone drops too low, the system loses momentum. At first, you may only see less fluid. Over time, other changes often follow. Desire fades. Erections feel weaker. The intensity of climax dulls. Beyond intimacy, many men feel more tired, notice mood shifts, and lose muscle strength. The important truth is this: this condition, known as hypogonadism, is treatable. A simple blood test can confirm it. With properly guided hormone therapy, many men regain healthier fluid production, stronger desire, better energy, and a noticeable lift in overall quality of life. This is not something to dismiss as just aging. In most cases, these causes can be handled effectively. But as your doctor, I also need to speak about the important exceptions. Sometimes, dry ejaculation is more than a manageable change. It can be a warning sign. That is why the symptoms that come with it matter. You should seek medical attention right away if this change appears suddenly and without a clear reason, especially if there is pain, blood in the urine or fluid, fever, or numbness in the genital area. These are not signs to ignore. They point to the need for an urgent urological check. Certain conditions can disrupt the nerves or pathways involved. Neurological disorders such as Parkinson's disease, long-standing uncontrolled diabetes, and in rare situations, specific urological cancers can interfere with normal signaling or flow. We also need to talk about the emotional weight of this issue. Many men tie the presence of fluid to their sense of strength and performance. When it's no longer there, anxiety, self-doubt, and frustration can quietly take over. Some men even pull away from intimacy because they fear judgment or feel less complete. The path out of that cycle starts with understanding and open conversation. This is a physical change, not a personal failing. Pleasure, erections, and emotional connection do not depend solely on fluid. Your intimate life can still be full, satisfying, and deeply rewarding. As we close, I want to leave you with a simple, reassuring plan to help you regain control. First, do not brush this aside. Look into it. Whether it starts suddenly or develops over time, dry ejaculation is a reason to see a urologist. In many cases, a detailed conversation, a basic exam, and a blood or urine test are enough to identify what is going on. Second, manage the conditions beneath the surface. Issues like diabetes, high blood pressure, and high cholesterol affect the nerves and blood flow that make this process work. Keeping them under control protects the entire system. Third, stop carrying this alone. Speak honestly with your partner and your doctor. Sharing your concerns lifts the burden and opens the door to real solutions. With the right medical guidance, whether through adjusting medication or starting targeted treatment, you can rebuild confidence and move forward with clarity. To bring this home, gentlemen, the absence of ejaculation does not mark the end of your intimate life or define your masculinity. It is your body asking for attention, a message that deserves to be listened to and explored with the right professional guidance. When you understand the cause, whether mechanical, obstructive, or hormonal, clarity replaces fear and calm replaces doubt. I have watched many men reclaim their confidence, energy, and hope, and enjoyment of life once they received clear answers and a practical plan. Your strength is not measured by fluid volume. It shows in your health, your sense of balance, and your ability to connect and live fully. Do not let uncertainty or embarrassment hold you back from seeking answers. Taking action early can completely change your experience and restore the sense of security and closeness you deserve. If this message helped you, please share it with a friend, a father, or a brother. This knowledge can truly shift a man's mindset. Like the video to help it reach more men, and subscribe with notifications turned on so you stay connected to future discussions on men's vital health. Your strongest years can still be ahead. Stay proactive, stay confident, and stay blessed. I am Dr. Ada James, and I will see you next time.